I'm Rachel Schlein. I'm one of the behavioral health liaisons with the Kennebunk Police Department.
I'm Melissa Medeiros, and I'm a behavioral health liaison.
So what's a behavioral health liaison? So a liaison is someone that we employ at our police department that specializes in mental health. Somebody that works with the police department, with our police officers to co-respond to calls for service that may involve somebody with mental health issues and or substance use disorder.
Behavioral health liaisons is kind of a connection between the police department and the community that we serve. They serve right along with us, with the officers. They respond to calls, and they're able to do a little bit of a different job than the police officers here are. They're able to perform or provide services that in the past we haven't been able to provide to our citizens.
I'm like a social worker. I co-respond with officers, and I help people connect with resources for the community, and I do referrals.
On a typical day, the majority of our time is spent following up on calls for service. So making phone calls, reaching out to people in the community, meeting people in person. And then when calls come in as needed, we'll go out with officers as well.
I don't go out on every single call. I mostly mental health calls, deaths, overdoses.
The liaisons can help de-escalate situations. And from then on, it's a matter of connecting the resources for that individual. So the police officers, they're already taxed enough with the calls of service, the amount of calls that they respond to. So if we're able to get that person the help that is needed, we reduce those calls, those repeated calls to service to the same individual.
When I go out on a call with an officer, the call will come in, and I'll ride with the officer in the police car in the front, and we'll go and talk about the call on our ride over there and figure out a plan. And when the scene's safe, I'll be able to come out and communicate with that person that needs a social worker. And throughout the whole thing, time that we're on the scene, I'm constantly collaborating and communicating with the officers there, and the fire department and EMS is there as well.
About 20% of calls for service involve somebody with substance use or mental health issues. And that's going to increase substantially when there's an arrest involved. I would say the majority of people that we arrest may have some type of mental health or substance use disorder.
We can kind of pick up where they leave off in terms of following up with people in the community when there's sort of ongoing needs that an officer learns about when they have contact with an individual or family in the community. We can help the officers know that that person is getting the support they need.
I think the citizens have been very open to their help, their guidance, and I see that it's actually made a difference in our police services or our town services. There's less voids in the service that we're providing.
They can essentially help save a life. I'll use an example. Somebody suffering with a substance use disorder, especially with the opioid epidemic that's ongoing. If years gone by when officers would respond to an overdose, they would go maybe get that person to the hospital. That was the end of the story. But what that person needs is some help. They need to know where to go. And many times they're lost, they don't know where to go. Now the liaisons can continue to follow up these individuals, make certain that they have the resources that are out there and are needed, and help guide them to those resources.
A lot of what we try to assist people with is navigating those systems and finding the assistance that they need.
Our liaisons are very well trained, they're compassionate, and they're really willing to help. They're willing to try new ways and try different things to make the services better for our community.
We're here to help, and it's confidential. If we can't personally help you, we will connect you with resources that can